Hello, my name is Lisa Walker. I've been a registered dental hygienist for 35 years. And about 4 years ago, the practice that I was working in was a traditional dental practice. My doctor developed cancer and decided that he needed to sell the practice. And it was bought by a biological and holistic dentist. His name is Thomas Lokensgaard, and we are here in the Nashville area in Tennessee. So at first it was like, a biological dental office. That sounds interesting. Kind of set in my ways. I wasn't really sure what to expect because the only thing I really knew about biological dentistry was that they didn't do fluoride. And that was all that I knew. But I did have quite an interest in learning about what it was going to be like because I had already made some changes in my own life to eat cleaner and to be more aware of my environment and the toxic things that were coming into my body. So I had a little bit of a thought of what it might be like. So I, in the next 6 months, transformed this dental practice into a holistic practice. Now, Dr. Lokensgaard had plenty of patients of his own, but I think that I brought in about 200 patients from traditional into holistic, freaking out at first as to what we were going to do to them and if we used dental anesthetics and all kinds of things like that. So as their dental professional for 4 years, 5 years, they trusted me and were able to move through the changes pretty easily. And I'm actually kind of proud of the fact that I brought them along with me into our practice. So that's kind of the history as to how I got into biological dentistry. Now, I listened to my doctor talk to my patients. I listened to my patients teach me. And within probably about 6 months, I was starting to feel a lot more comfortable. I knew what oil pulling was, and I could tell people to brush their teeth with coconut oil and baking soda and start to discuss remineralization with them and tell them what they should be doing at home and how to work in a more biological atmosphere. I explained to a lot of my patients how we didn't do crowns with metal frameworks anymore. Everything was done in ceramics. How we safely removed mercury fillings from their mouths and why that was important not only for them, but also for the staff to be in a safe environment. So those were some of the things that we hit upon really quickly. But what I started to really realize as I started working in biological dentistry was that the dentistry wasn't even but about this much of the importance of what was going on during an appointment. It was more about the validation of the patient that they weren't crazy and that there was actually somebody out there that was willing to listen to them and work with them and try to come up with a plan that may help them. So lots of Lyme patients were dealing with inflammations and chronic pain, all kinds of things that maybe I had dealt with before, but I wasn't able to dive into it and help them bring the biological part of what I did inside of their mouths into helping them be healthier people. Most of the time, the biggest differences in biological and traditional dentistry is the materials that we use. And it's about what happens in their mouth and how what's going on in their mouth can affect the rest of their body. And I already knew that as a dental hygienist, but it wasn't really something that I preached, right? I was you got a little bit of bleeding, and now it's like you have bleeding, and this is not acceptable anymore. This is an infection that's moving throughout your whole body and affecting your organs. And it's a whole different perspective in the teaching and educating part of what we do for patients. We work really, really hard to eliminate all of the metals in their mouths so that we prevent the galvanization of the different metals hitting to each other, which causes electrical disbalances in their bodies, which can throw them off tremendously with their health. We want to eliminate metals. We don't do the fluorides. We don't want to do anything that could actually cause harm into their body. So things like root canals, we don't want to have these low-grade, no-pain infections going on. So we're constantly looking for those kinds of things in their mouths also. So root canals are a big part of what I look at and diagnose as, well, I don't diagnose, I'm a dental hygienist. But that's another thing that we look at very closely, which we never did look at in traditional dentistry because it was accepted that these nasty infections were okay to leave be. I know better than that now. So we use also much more natural remedies to help people become more healthy instead of pharmaceuticals. So things like antibiotics don't come out of our practice. If they do on occasions, we still need them. But they're not just prescribed constantly, as root canals are not prescribed constantly. So we know things about cavitations, for example, where there's still holes in people's jaws that never quite filled in properly and healed properly, that are causing havoc on their bodies. So they need to have those evaluated and checked. And I've now learned how to, look for those and listen to symptoms and see if perhaps that's something that we need to look at even closer with these people. We do a lot of supplementation in our office. My doctor is also a naturopath by nature. He can't practice in Tennessee, but he's got the knowledge. And through the COVID, we've helped them learn a little bit more about what zinc can do for them and what vitamin C can do and vitamin D. And then we've talked with them about ozone and ozonation water. And we can use ozone water to help kill coronaviruses in their mouths and inside their bodies and in their guts. We use ozonation to help flush out bacteria in their mouths. It's just a tremendous group of new information as I've moved into biological dentistry. We test patients for biocompatibility. So I see a lot of times as a hygienist, the edges around a crown, and I see it a lot in gold for sure, but more where you have a long metal at the gum line areas, they're just constantly red, inflamed, bleeding. Nothing that I do, nothing helps them. And then you start to realize, well, this is probably a metal allergy. So biocompatibility tests help us to determine if maybe some dentistry needs to be done, redone. And then, of course, we use biologically compatible materials in all of their new dentistry so that they're able to see better results, because the stuff that we're putting in their mouths is not causing them to have a chronic inflammation process going on. Meridian Charts. Who has ever heard of a Meridian chart until you get into biological dentistry? But I will tell you, I pull that chart out 3, 4, 5 times a day and say to them, hey, you've got listed here that you've had problems with your lungs or a hip or a cough or something like that. And sometimes we can relate that all back into a tooth. And it's very interesting when we can finally figure out that one thing that's been missing from their whole treatment that could possibly be the one thing that they need to fix to heal themselves. It's about healing themselves, not about necessarily what we do, but about how we're able to help them, assist them into healing themselves. I think biological dentistry is so much more about the relationship with the patient, listening to them, understanding them, giving them a chance to voice what's wrong. These people know what they're feeling. I'm the kind of person that when I go to the chiropractor, I can tell them that this is off or that's off, because I'm so aware of my own body and the way that it reacts to things. And I think with biological dentistry, we're able to listen to these people and find relief for them. And it is so exciting. I know that within that first year of changing into biological dentistry, I just felt like I had renewed everything. I was this brand new hygienist with all this new information that I couldn't wait to explain and tell the patients. And it continues constantly. With the COVID quarantine, I've spent a lot of time with education. At first, I was pretty freaked out about it, knowing that we were in the high risk, high aerosol job line, right? So I knew that I need to figure out what we needed to do to protect ourselves from this virus, since it was airborne. And I'll tell you what, there's very little we have to do to change, and that's so exciting. I mean, I'm gonna wear a mask. This curly hair is gonna have to be covered. Put some hats on and a mask, and we already have ozone machines throughout our offices, so our air is gonna be constantly being hit with some great ozonated air. We're already using ozonated pre-rinses to help reduce the bacteria in the aerosols. It's not that difficult. Now that I understand it, I'm not so freaked out about it, and it won't be long and I get to go back to work again. So I'm excited about that. What else? Oh, MTHFR. People, I'd never heard of this before too, but now I can understand that. I know that when they have this gene snips that's a little bit off, that they react to things differently. They don't quite do it the same way somebody that doesn't have it does. So there's other things that we have to actually look at as influences into the way that we treat them. So biological dentistry is so much more than just their teeth. It's more about their body and how it relates to their mouth, and how their mouth, being the very first part of their body in their digestive systems, is so exciting. I love biological dentistry. I am so excited to have completed my testing, and this is my little video to kind of explain to you where biological dentistry falls into my life. And thank you so much for listening.